Every medication comes with its potential side effects. And one of the most popular medications right now, the GLP-1 agonists, have a few very common side effects. And I'm going to talk about one of those today and how you can manage it. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I treat patients through my telehealth clinic, Missouri Metabolic Health, and I help my patients manage their weight through lifestyle optimization and the utilization of safe and effective medications, often our GLP-1 agonists. If you are not familiar with what these medications are, the brand names are Ozempic, Wegovy, Mounjaro, and Zepbound. Those are the four most common, and there are a few other ones. The generic names or their active ingredients are semaglutide or tirzepatide. These are very commonly prescribed for a few indications, most commonly type 2 diabetes and obesity. And I did a whole video about whether or not these medications are safe, so I definitely recommend that you check it out, and I'll include the link here. But I want to talk about one of the most common side effects today, and that is constipation. And I'm going to talk about why it happens and things that you can do to help prevent it or help manage it if you experience it while on a GLP-1. And this can help with constipation for any cause. Many medications that are prescribed can lead to constipation, or it can happen just on a day-to-day for anybody. And so these tips will help. So warning, for this video, we are going to talk about bowel movements or poop. And this is something that is not commonly talked about, but as a physician, I talk about this fairly often with my patients. I want to start with the Bristol stool chart because this can help us to give categories or classify what our poop or our bowel movements actually look like, and that can give us a lot of information and make sure that we're on the same page when we're talking about constipation and changes in bowel movements. And so ideally we have a Bristol stool 4, and that is a healthy bowel movement, and that's what we're looking for to have every day, twice a day, every other day. Like I said, it varies from person to person. If we're going more towards type 1, then that indicates leaning more towards constipation. The stool is staying in our gut too long. And that is constipation. If we're leaning more towards type 7, then that is looser stools or diarrhea. And that is a whole another topic that we are going to pass on today. I want to take a moment to actually talk about what constipation is, because many people think that everybody needs to have a bowel movement every day, and that's what is normal. The truth is that there's a range of what is normal from person to person. And so some people go once a day, some people go twice a day, some people go every other day, and that is okay. The goal is to have a formed bowel movement on a regular basis and to avoid the feeling of fullness and uncomfortability. The reason that we see constipation with GLP-1 agonists is because one of the mechanisms of action of GLP-1, or the way that it works as a medication, is that it slows the movement of the GI tract. And so food sits in the stomach for longer, and that helps us feel full on less food and for a longer period of time. So it helps with portion control. But that slowing of the GI system can lead to constipation because things are not moving as quickly as they normally do. And that can lead to less frequent bowel movements, some bloating, and an uncomfortable full feeling. If you have a history of constipation, or this is something that you struggle with on a regular basis, that does not mean that you cannot take a GLP-1. It just means that we need to monitor it more closely and be more aggressive at managing your symptoms. We're going to go over 4 things that you can do to help manage these symptoms, and then we're going to go over signs of when to seek help from your physician. The first thing that I want everybody to do is to drink more water. If you are dehydrated, your body is going to need to keep all of the water available to it to help keep it or to help increase the hydration. And so it's going to pull that water out of your stool, and it's going to make that stool hard and difficult to pass. And so dehydration is a major cause of constipation. And the GLP-1 agonists can lead people to be more dehydrated because you may not have the typical thirst signals that you normally have. Sometimes they get blunted by the GLP-1 action, and you're typically having smaller volumes of food and smaller volumes of fluid. And so you have to be very proactive and make sure that you are drinking a full glass of water with all of your meals and then drinking water throughout the day. I recommend always keeping water next to you. I always have a glass of water here or a water bottle so you can keep track of how much you're drinking. And I know for some people this can be a tricky habit to build, but just start where you are and then slowly drink a little bit more throughout the day. There is no expectation to go from 30 ounces a day to 80 ounces a day. You can add slowly over time. If you absolutely do not like the taste of water, feel free to flavor it with cucumber, lemon, fruits, or you can do sugar-free electrolyte drinks. That is absolutely okay. Just make sure you get those fluids in. You know that you're hydrated enough when your urine is either clear or a very light yellow. So that will give you immediate feedback to whether or not you are hydrated. Number 2 that you can do is you can increase your fiber in your diet. And the main sources of dietary fiber are fruits, vegetables, and whole grains. And so making sure that you're incorporating more of these foods in your nutrition plan can be very helpful. I always recommend doing this slowly. Maybe pick one meal a day for a week to add on a source of fiber, whether that's the vegetable or the fruits or the whole grain. Add that in, let your body get used to that, and then the next week add another one and another meal, and so on and so forth. The recommended amount for men is 35 grams of fiber per day, and for women it's 25 grams of fiber per day. And so if you are not sure where you're at right now, you can do a nutrition log with an app like MyFitnessPal or another free app and track how much fiber you're taking in over the course of 3 to 5 days. And then you can add by a few grams each day until you get that goal. Not only will fiber help you have more frequent bowel movements and manage your constipation, but it'll also help keep your blood sugar stable. It'll help lower cholesterol. It'll help you feel full longer, which can help with portion control as well. If you are unable to reach your fiber goals through nutrition alone, it is okay to add a fiber supplement, and there are plenty out there. The main fiber supplements are psyllium husk. The most common brand is Metamucil, but you can buy off brands. And the other most common is methyl cellulose. And I actually have some of those on hand right here. And this is just one brand, the Citrazole. And these come in tablets. The Metamucil comes in a powder, the psyllium husk comes in a powder. But even though these come in capsules, it is very important to drink with a lot of water. So you take the pills and then you have the water along with it. That allows it to expand and work as the fiber in your system. So really important to drink the water along with that. Those fiber supplements are safe to take on a regular basis. So you can take them every day or even twice a day if needed. Stimulant laxatives, on the other hand, so this is number 3, things that you can do over the counter or at home. Stimulant laxatives are best utilized on an as needed basis. And that is because these medications are telling your GI system to start going and moving forward. And if used consistently over a longer period of time, your GI system gets used to that, and then it is very hard to go without using these medications. So the fiber supplements are good to use on a regular basis, and then the stimulant laxatives are great to use as needed. A common example of a stimulant laxative is Senna. And this medication that I had on hand actually has 2 medicines in it. It has Senna, which is a stimulant laxative, and then it has Docusate. And we want to do ideally the combination because the Docusate is a stool softener. So that is going to help soften the stool so it's easier to pass when your stomach is, or when your GI system is starting to move things along. If you do not have this stool softener aspect and the stool is really hard, then your GI tract is gonna squeeze against that and that's gonna cause stomach pain. And so ideally you want that combination. So I would look for the Senna and the Docusate. Again, the store brand is just fine rather than the brand name. You can save a little bit of money there. There are also osmotic laxatives that kind of fall between the fiber supplement and the stimulant laxative. And common examples include polyethylene glycol, or Miralax is the most commonly used over-the-counter version. That's another powder that's mixed with water. Usually comes in a purple tube. There's milk of magnesia, lactulose, magnesium citrate. These options work by pulling the water back into the stool, again, to make it soft and easier to pass. Before you use these options on a long-term basis, I would talk with your doctor to make sure that it is safe for you. And a bonus, I love bonus tips, is moving your body. And the more that you move your body throughout the day, you're going to stimulate that GI tract movement as well. So moving your body can also help with constipation without using a medication, which is great. If those strategies are not working for you, definitely reach out to your doctor. There are some prescription medications that may need to be utilized to help you with your constipation. So I would give yourself a week or two of trying these solutions, and if you're not getting the results, getting back into a regular bowel movement routine, I would talk with your doctor because there are prescription medications that we can utilize to help treat your constipation and keep you on your GLP-1 if that is best for your health long term. And lastly, red flag signs to look out for, to definitely call your doctor right away, or maybe even go to the emergency room or urgent care, is if you are no longer passing gas, or if you go to drink water or eat some food and then are vomiting while you're constipated. These could be signs of an obstruction and you want to have that evaluated and managed right away. Also, severe and sudden abdominal pain, you would want to have that evaluated too. So in conclusion, constipation is a very common side effect of GLP-1 agonists. For most, it's fairly mild and can be managed with lifestyle changes like drinking more water, moving their body, increasing dietary intake of fiber, or adding a fiber supplement, and then using a stimulant or osmotic laxative as needed. But if it is a more persistent or severe issue, then this is something that should be managed by their physician or provider and can be treated effectively. I hope you found this helpful. I'm going to do more videos about how to manage the side effects of GLP-1s. If you have any particular question, definitely put it in the comment below or send me a message on my website. You can send me a message at MissouriMetabolichealth.com/contact. And I would be happy to address your concern, whether directly or through a future video. And next week, I'm actually going to talk about how to introduce more fiber in your diet. And so definitely subscribe and catch that video. I'm going to give you some tips that I've learned from a lot of dietitians that I've talked to. It's going to be a good one, some things that I've implemented myself. I hope to see you next week. I wish you nothing but the best. Have a happy and wonderful week, and I will talk to you next time.